Hello, my name is Ana Vaz and I am a PRM physician at São João Hospital, Portugal, and also the country ambassador for Portugal at the ISPRM Youth Forum. Today I have the pleasure of interviewing Professor Ali Otom. Professor Otom is a PRM physician specialized in spinal injuries and musculoskeletal medicine, currently working as the CEO of the Royal Specialty Center for Spine and Musculoskeletal Disorders and at the Jordan University Hospital. Professor Otom's institutional activities are worth highlighting, namely his position in the External Relations Committee and as an advisory member of ISCOS, and also at the International Society of Physical and Rehabilitation Medicine. Furthermore, Professor Otom is very scientifically active, something that is demonstrated by his position on the editorial board of the Journal of the International Society of Physical and Rehabilitation Medicine. Professor Otom is one of the keynote speakers of the upcoming ISPRM Congress, which will be held in Morocco in November 2025. So, Professor, how are you today?
Thank you very much. I'm very well.
So I will start with my first question for today, that is, what can you tell us about your keynote lecture? Can you give us an idea regarding the topics that you will be discussing?
Yeah, absolutely. First of all, allow me to thank you very much and the ISPRM for giving me this opportunity to talk about the upcoming ISPRM Congress. And you know, this Congress is from our point of view, it has a special value. As you know, the ISPRM Congress in 2025 was supposed to be in Jordan, but due to unforeseen conditions, we were obliged to cancel. And in spite of the fact that we were saddened by this, but we were very pleased to see our colleagues in Morocco together with ISPRM to find a venue, and a nice venue like Marrakesh, to keep the ISPRM Congress going on in a beautiful venue, and to allow the ISPRM members to meet and to share knowledge and experience. And from this point of view, it's my honor and pleasure to be one of the speakers in this Congress. And I was asked to talk about spinal cord injury in the MENA region, that's the Middle East and North Africa. As you know, spinal cord injury is a very special injury. It's considered one of the most devastating injuries that can affect humankind. It's very disabling, and it can affect not only the neurology in the human being, it affects the whole system, from the cardiovascular, respiratory, gastrointestinal, urinary, including the psychosocial aspect of the human being. So it is a multi-system injury. It has a very special impact on the individual who are affected. And in this talk, we will explore the details about this injury, particularly in the MENA region. And MENA region, you know, is special in its demographic characteristics. This region contains more than 500 million population, and the data about spinal cord injury are still not in the best standard that we wish. There are a few epidemiological studies, and I could, gather some ideas about the incidence and prevalence of the spinal cord injury in this region, which is so far near the international incidence, which is around 25 per million per year. But as I mentioned, the epidemiological data are not in the best shape which we want, and we hope that we can get something better in the future, because as you know, in spinal cord injury, we are, in spite of the advancement in treatment and the technological advancement, there are no final cure for this injury. And so probably one of the crucial aspects is to focus on the prevention. When we talk about prevention, we talk about the importance of doing proper epidemiological studies. And in order to look at the causes, to look at the characteristics in every part of the world, and probably to make collaborative effort from the whole region to give standards of care and for prevention strategies in the future.
Okay, thank you very much. It will be certainly a very, very interesting and inspiring lecture. I would like to ask you also, what do you think and what can you tell us regarding the challenges and particularities in the approach of spinal cord injuries in your region?
Yeah, definitely. You know, my professional career in PRM specialty, and particularly in spinal cord injury, more than 3 decades. And I can tell you simply that one of the most important challenge in our country and in most of the countries in this region, that spinal cord injury, as I mentioned before, it is a multi-system injury. In many places is looked at as just a fracture of the spine or a friction of the vertebrae, and the major aspects are neglected. Many patients are still managed at general hospitals where they are provided, the surgical approach or the immediate medical approach, but without taking the proper multi-system or the multidisciplinary system approach which is needed in the management of this injury. So the lack of the specialized centers in this region to deal with the spinal cord injury, one of the major challenges in our region. Healthcare professionals who are trained in these specialties are not in the enough or the sufficient number, and this would definitely include the physicians, physical therapists, occupational therapists, psychologists, social workers, etc., who are, and nursing, of course, who are experienced in managing spinal cord injuries. And of course, we are facing also the social stigma, lack of advocacy for this particular aspect of spinal cord injury in our region.
Okay, thank you very much. So I would like to end asking you, what are your other plans during the ISPRM Congress besides your lecture?
Yes, definitely. I look forward. Actually, I've been one time to Morocco, and we visited Fez. But I know that Marrakesh is having, is a special historical and cultural center, and it's a beautiful city. I look forward to see this part of Morocco, and also to explore the hospitality and generosity of our friends and colleagues in Morocco. Definitely, and I'm sure that our colleagues in Morocco, under the guidance of ISPRM, are planning a very fantastic and attractive scientific and social program. And we look forward to explore all these aspects, and we wish them all the success. And I am sure that we are going to see a very successful and special ISPRM Congress in the coming November.
Yeah, I agree. Thank you very much, Professor. We are also very excited about your keynote lecture. So I will meet you in November at the ISPRM Congress in Morocco. Thanks again and have a nice day. Bye-bye.